Governor Walker's bill would give the state more authority to alter Medicaid without removing public input. Fox 11's Ben Krumholtz brings us balanced coverage of the proposed changes.
With thousands of people protesting about workers' rights in Madison, perhaps lost in the shuffle is a budget issue that could affect 1 out of 5 people in the state.
Our voices will not be heard.
Lisa Fregoso and her daughter, who live in De Pere, are disabled. They are 2 of about 1.2 million people in the state who receive assistance from Medicaid. In Governor Scott Walker's budget bill, decisions about public medical assistance programs would be made by the Department of Health Services with approval from the Joint Finance Committee. Right now, those decisions go through the legislature with public input. On page 7 of the bill, it says DHS may promulgate the rules as emergency rules. That would allow the department to set rules on eligibility, cost sharing, benefits covered, and reimbursement rates.
We need to have more flexibility, and we need to have the ability to make an appeal to the federal government.
Based on the proposed changes for income eligibility, more than 50,000 people could lose coverage in July of next year. Fregoso says if she lost her medical help, she wouldn't be able to afford her or her daughter's health care.
People in general do not understand what it's like when you have all the disabilities or health issues. If they've never been in your shoes, legislation should hear it from our hearts what we have to go through daily.
Walker says the changes are necessary because Medicaid accounts for half the budget gap during the next 2 fiscal years, or $1.8 billion.
But we are going to move for changes that allow people to make that, particularly when it comes to Badger Care, not a permanent entitlement, but something that as we ease people into the workforce, we also start to adjust those things so that it's not a permanent way of life.
I understand the budget is important, and they need to make cuts somewhere, but cuts on people's health and their lives, I don't see that that's fair.
The Wisconsin Council on Children and Families says with everything going on in Madison, it has had problems getting a hold of legislators about addressing the issue. It says when it has talked to lawmakers, many of them didn't have much to say about the medical assistance issues in the bill because, like the public, they hadn't heard much about it. Ben Krumholtz, Fox 11 News.